Erectile dysfunction, ED, also known as impotence, is a condition where a man consistently struggles to achieve or maintain an erection sufficient for satisfactory sexual performance. This issue is more common as men age but is not a normal part of aging. The symptoms and signs of erectile dysfunction vary, depending on the underlying causes, which can be physical, psychological, or both. Here is an in-depth look at the main signs, symptoms, and potential causes associated with erectile dysfunction. 1. Primary symptoms of erectile dysfunction. A. Difficulty achieving an erection. One of the most immediate signs of ED is the inability to achieve an erection despite sexual stimulation. This can occur intermittently at first and gradually become more persistent. B. Difficulty maintaining an erection. Another sign of erectile dysfunction is the inability to maintain an erection long enough to engage in sexual activity or reach orgasm. Men with ED often report losing erections during intercourse or before completing sexual activity, which can lead to distress and embarrassment. C. Reduced sexual desire. A decline in libido or sexual interest often accompanies ED, especially if it has psychological causes. This reduced desire can result from a variety of factors, including stress, anxiety, or depression. D. Premature or delayed ejaculation. In some cases, ED is accompanied by issues like premature ejaculation, ejaculating too quickly, or delayed ejaculation, struggling to ejaculate despite arousal and stimulation. While these symptoms do not define ED on their own, they often occur together. 2. Psychological symptoms linked to ED. A. Anxiety and stress. Men experiencing ED often feel anxious about their sexual performance. This anxiety can sometimes create a cycle of fear where the anticipation of failure leads to further erectile difficulties. B. Low self-esteem and depression. The impact of ED on self-confidence can be significant, especially if the condition persists. Persistent ED can result in low self-esteem and, in some cases, depression due to feelings of inadequacy and frustration. C. Strained relationships. The interpersonal effects of ED are also significant. In some cases, ED can strain relationships as it may lead to feelings of rejection or frustration for both partners. Open communication and support are essential to managing these challenges. 3. Physical symptoms that may indicate underlying health issues. Sometimes, ED is a symptom of an underlying physical health problem. In these cases, other signs may accompany the primary symptoms of ED. A. Heart disease symptoms. ED is often a precursor to cardiovascular problems. Symptoms like chest pain, shortness of breath, or fatigue can sometimes indicate underlying heart disease. B. Symptoms of diabetes. Men with diabetes are at a higher risk of developing ED. Symptoms of diabetes such as increased thirst, frequent urination, blurred vision, and fatigue can occur alongside ED. C. High blood pressure. ED may also signal hypertension, which often has no obvious symptoms. However, headaches, dizziness, or nosebleeds may accompany high blood pressure and contribute to ED. D. Hormonal imbalances. Low testosterone levels or hormonal imbalances can lead to ED. Other symptoms associated with hormonal issues include fatigue, mood changes, and muscle weakness. 4. Psychological causes of erectile dysfunction. ED is often connected to psychological factors, which can either be the root cause or an aggravating factor for ED. Some common psychological causes include A. Performance anxiety. This is the fear of not being able to perform well sexually, which can lead to ED. The anxiety over potential failure can create a cycle of repeated occurrences of ED. B. Depression. Depression affects sexual desire and men who are depressed often experience symptoms of ED. Antidepressant medications can sometimes exacerbate these symptoms. C. Relationship problems. Tension in relationships, whether due to communication issues or unresolved conflicts, can contribute to ED. Working on these issues can help in resolving the associated sexual difficulties. D. Stress. High stress levels, whether from work, financial issues, or family responsibilities, can interfere with sexual performance and cause ED. Stress affects mental focus and reduces the ability to relax, which is crucial for sexual arousal and response. 5. Physical causes of erectile dysfunction. A. Cardiovascular disease. Atherosclerosis, or hardening of the arteries, restricts blood flow throughout the body, including to the penis, making it difficult to achieve an erection. Conditions like high blood pressure and high cholesterol levels also contribute to ED by narrowing blood vessels. B. Diabetes. Diabetes can damage blood vessels and nerves that control erection. Men with diabetes are significantly more likely to experience ED due to this nerve and blood vessel damage. C. Obesity. Obesity is a risk factor for a range of health issues, including diabetes and cardiovascular diseases, both of which can contribute to ED. Excess weight can also affect hormone levels, which plays a role in sexual health. Neurological disorders. Conditions such as Parkinson's disease, multiple sclerosis, or stroke can interfere with nerve signals between the brain and the penis, affecting erectile function. E. Hormonal disorders. Low levels of testosterone, the primary male sex hormone, are linked to ED. Conditions like hypogonadism and other hormonal imbalances can disrupt sexual function. Thyroid imbalances can also impact ED. F. Side effects of medications. Certain medications, including antidepressants, antihistamines, and blood pressure drugs, have side effects that may lead to ED. Men experiencing these symptoms may need to consult with their doctor to adjust or change medications. G. Substance abuse. Excessive alcohol consumption, smoking, and drug use can all lead to ED. Alcohol and smoking impair blood flow, while certain drugs interfere with normal hormonal functions. Diagnosis and evaluation of erectile dysfunction. To diagnose ED, healthcare providers often evaluate medical history, conduct a physical examination, and perform tests, including A. Physical examination. A physical examination can reveal signs of underlying health issues like hormonal imbalances or nerve damage that might contribute to ED. B. Blood tests. Blood tests check for diabetes, heart disease, and testosterone levels, which can help identify underlying conditions causing ED. C. Urine tests. A urine test helps detect diabetes and other health conditions that might cause ED. D. Ultrasound. An ultrasound exam can check blood flow to the penis, helping to identify vascular causes of ED. E. Psychological exam. If psychological factors are suspected, a mental health professional may assess issues like depression, stress, or anxiety that could be affecting sexual function. Treatment options for erectile dysfunction. ED is treatable, and the approach depends on the underlying cause. Some treatment options include A. Lifestyle changes. Improving diet, exercising regularly, quitting smoking, and reducing alcohol intake can enhance overall health and improve ED symptoms. B. Medication. Phosphodiesterase type 5 inhibitors, such as Viagra, Cialis, and Levitra, help increase blood flow to the penis. However, these are only effective if physical or psychological arousal is present. C. Therapy and counseling. For men whose ED is linked to psychological factors, therapy can help address performance anxiety, stress, or relationship issues. Cognitive behavioral therapy, CBT, is one effective approach. D. Hormone therapy. Testosterone replacement therapy can be beneficial for men with low testosterone levels. Hormonal treatment should be supervised by a healthcare provider. E. Medical devices. Devices like vacuum erection devices, VEs, or penile implants can provide solutions when medications and lifestyle changes are insufficient. F. Surgery. In rare cases, vascular surgery may help restore proper blood flow to the penis if blockages are detected. Conclusion. Erectile dysfunction is a complex condition with a range of physical and psychological symptoms that impact a man's sexual performance and quality of life. Recognizing these symptoms and seeking professional medical advice can help determine the most effective treatment options. Addressing underlying health issues, making lifestyle adjustments, and seeking psychological support can improve erectile function and lead to a fulfilling sex life.